Go ahead.
Okay, so call to order. Roll call, please.
Dr. Moore,
Yes.
Dr. Robinette,
Here.
Dr. DeGuzman, here, Ms. DeWitt,
Yes.
Dr. Gulich,
Yes.
Mr. Adamson, Mr. Griffith.
Okay, any additions or adoption of the agenda? Okay. It's a voice vote. All in favor?
I so move. Second.
Oh, moved in second.
There it is.
Okay. And can we voice vote?
Mhm.
Okay, all in favor, say aye.
Aye.
All opposed, same sign. Okay. Approval of the last minutes for March 20th. Need a motion.
So moved.
Second.
Okay, any discussion or questions? Okay, can we have a voice vote for that? All in favor of adopting the minutes, say aye.
Aye.
All opposed, same sign. Okay, public comments.
They're on the agenda.
Okay, thank you very much. I appreciate that. Old business. Ms. City.
Thank you. So last month, I brought before you guys Creations Market, a food facility that had some outstanding violations of food code. You guys suspended their license for 2 weeks. So on April 4th, we went back and it was noted that there were still multiple food items that were unlabeled. And there were some dead cockroaches in bottom of some cabinets. And the facility had yet to enroll in a food safety training course. So Chris extended their suspension for another week. On April 14th, we completed another inspection and noted that all the food items had been properly labeled. And we were given proof that they had signed or enrolled in a food safety course in May. So we allowed the facility to reopen. So they are currently back open.
So we have no action on that. Thank you very
Thank you.
much. Okay, moving to new business. We have a sewage variance at 4782 Peacock, Mississippi.
All right, thank you. All right, so on this property, the Ohio Administrative Code requires that on sites where the installation of zone septic system within the same system that are directly upgradient from each other and on the same slope, when it's unavoidable, there should be no less than 50 feet between soil absorption components. So there are visuals in your packet on this one, drawings. And due to lot limitations, there isn't enough room to fit a system along contour and have the required 50-foot separation distance between the two mounds. So on this property, they could have fit one continuous mound. However, the property, the elevation significantly starts to drop as you go from south to north, which is the length of contour. And on a mound, any leach field, you want your distribution line to be along contour. And it was 12 inches of difference from one end to the other. So we were not okay with that. We said, you can't do that. So look at other options. So they designed a split mound to try and keep it more on the same elevation. But because of that, they're unable to keep the 50-foot separation distance between the two mounds as required in code. There is kind of a drainage swale running through the property to the west of where the mounds are located that we have to keep away from. This property has a shallow seasonal water table, which is why we're putting in a mound. So the designer also designed a perimeter drain to run between the two mounds and around the sides of the mounds to help collect some of that water to take it around. So on this design, there is 30 feet between the distribution laterals, which is the top middle of the mound, and 15 feet between the toes of the mounds. So in this situation, the property owner's requesting approval to allow the installation of zones that are directly upgradient from each other on the same slope with less than 50 feet between soil absorption components.
Okay, so there's supposed to be 50 feet in between the two mounds,
Yes,
and they have 15 feet,
15, yes,
and it's already wet.
yes,
And are there other properties close by?
yes.
Is there any other system that they could possibly install?
So we did ask the designer of that. There are a couple other types of systems. One is a drip system. We don't currently have any in Clark County, so I can't speak super well on the design and things of those to explain them to you at this time. And then there is, if you'll remember, a couple of months ago, we had the one out on Sylvan Shores, the pad dispersal, where it's a big gravel pad. That is another option potentially, but this designer, I'm not sure why, but did not look at those other options.
So you said that they would also put in a drainage system?
Yes. So what the perimeter drain is, similar to a French drain, maybe if you're familiar with a French drain, that is designed to collect any of your like seasonal water, groundwater, and move it away from, sometimes they come around foundations of homes, things like that. So they're putting it in between there to try and collect some of that seasonal water and move it away from the mound area.
So it's gonna move away from the mound area, but the whole property's wet.
Mhm.
What's the reserve area?
So their reserve area is to the east or the right, if you look on the right-hand side of the drawing. An area along on the back.
They have to keep that much space, is that what that?
Yes,
Oh,
yep, so
okay.
they can't do anything
In there,
Yeah.
okay.
besides put a septic system.
Can you recap one more time what the risks are with this double mound variance? Like what are we potentially anticipating?
So the code requires that there be 50 feet between those soil absorption areas. So that way, when the sewage filters through, it goes down and it starts to spread out. So the reason for that 50 feet in there is so that as it absorbs and moves out, it's going to absorb in before the sewage essentially meets and potentially comes up and surfaces. Yes.
This is not an easy one.
No.
I will tell you, this is probably, as the board members that are here today, this is probably I would say the most complex one with a lot of different variables here. If you are searching for the right question to ask, you can continue to think about that. But in the meantime, I will tell you, Zibby and I have talked about this. We find this to be a very difficult one to approve. As subject matter experts in this, I have some serious concerns about this one. I think we're going to set this up for some type of failure in the not too distant future. It's a very wet property. We're talking about capturing some of the water in this French perimeter drain and putting it onto the property. So yes, it's going to be on the property, but where it extends to, you can see it gets pretty close to the property line.
So I don't know, the blue line here with the dotted lines, that's the perimeter drain.
And there are neighbors just beyond the
Yes,
perimeter?
there are actually neighbors on both sides, and then across the road, there's not one to the east.
they can't put one of them either next to it or go up the yard more, if that wouldn't work? Like if you took one of those, you can't come up in that area?
So we can't come up in here because this is not an approved soil area.
Oh, okay.
So the green is what the soil scientist has designated as soils that are suitable for a septic system.
Okay.
And that's why the rest of the lot is wet, because it wasn't suitable soil.
I mean, I don't know. I didn't talk to the soil scientist and say, why did you not put it somewhere else? But there's some reason he did not. So what
Tell
they,
me the alternative again.
like I said,
The gravel.
so a designer would have to design it, but options are like a pad dispersal, and it's similar to this. They can make it maybe wider and shorter. Same kind of thing they would build up with a pad, and then they pre-treat it to unit, it filters through there, and then it goes out into the gravel and sand and filters out into more of a pad versus singular lines. So those are ones, like if you can't get that length on contour, kind of like we can't here because it drops off, they can make it wider instead of longer. But it's one big area, leach area versus like the single lines like are in the mound. They would still have to build it up with the pad. They're still gonna have to, because our seasonal water table here is like 10 inches. And here in Clark County, when these rules came out, the board at that time said, we want an 18-inch vertical separation distance between that seasonal water and where the bottom of our leach trench is. If we do the pre-treatment, then we can get closer to that seasonal water.
So would that be another full survey
So they would have to just redesign it.
redesign?
Yeah, they would have to submit a new design with that type of system. And then we check to make sure it meets the code requirements for that type of system.
The money they spent on the soil survey would still be.
Yes, the soil survey is still good.
Are there any additional questions?
If we don't approve the variance, we would be able to ask them to make this redesign, right? We can send that.
Yes, we would
Right.
send it back and say, this is not approved as design, you need to have a new design submitted.
Is this new construction?
It is.
Okay. So would this hold them up with their construction a lot, or are they trying to do this while they're doing?
I'm not sure
Not
where
sure.
they're at in the
Okay.
process of building their house, I'm sorry.
Okay.
So I would feel comfortable with that, rather than,
Asking them to redesign.
yes, rather than approving this variance.
Yes. Okay, any additional questions? On item 6A, resolution approving a household sewage treatment system variance for 4782 Peacock Road, allowing a household sewage treatment system to be installed with less than a 50-foot between soil absorption components with the responsible party signing a hold harmless agreement. Have the vote, please.
The resolution is to approve it.
Is,
Your
So
options are
we're
to.
not wanting to, we need to
we're
say no.
not.
Not,
Okay,
right,
Right.
not.
Right.
Yes.
okay,
Got there.
all right,
So moved.
okay,
Second.
okay. Is the vote? Is that-
Dr. Moore,
Okay, I'm voting not to approve. Okay.
Dr. Robinette,
No.
Dr. DeGuzman,
No,
Dr. Gulich,
No.
Ms. DeWitt.
so it was,
Not to approve.
The resolution is to
Or-
approve it.
oh, I'm not approving, no,
Okay, so it's a no.
no, okay, I just wanted to make
It's
sure.
okay.
Okay,
So,
all right. Okay. That's a hard one. Okay. All right, and so then we're just gonna ask them to come back with different designs. Okay, thank you. Okay, item B, sewage variance request, Zibby.
Thank you. All right, so on this one, the Ohio Administrative Code states that a sewage treatment system shall not be sited, permitted, or installed where sanitary sewer is accessible. Typically, accessible is defined as within 200 feet from the foundation of the house to the right-of-way in which the sewer lies. In this situation, again, you've got drawing in your packet. The sewer line is 82 feet from the corner of the house to the end of the sewer, where the sewer stops right now. The sewer is owned by the city, and when they require, or when someone wants to tie in to that sewer, the city requires them to extend the sewer to the farthest property line. So in this case, that would be 125 feet that they would have to extend the sewer. And you'll see in your packet, the property owner obtained a bid for the cost to extend the sewer and tie in, which was approximately $153,000. In this situation, the property owner is requesting the approval of variance to install a septic system where sanitary sewer is accessible.
And we only have one bid?
We only have one bid.
So was it not accessible to tie into before and now it is? Is that what the?
No. So this property actually lies,
Yeah.
sorry, it's kind of confusing, right on the edge of the city limits. So this dotted line at the bottom is where the green
This currently-
sewer is the city. And then north of it, where the house is in Moorfield Township. So the sanitary sewer has been there. But this septic system is failing. And so because sanitary sewer is accessible, we're not allowed to issue a permit to install a new septic system,
Oh, okay.
without a variance. And then to add to it, the only type of system that we would be able to put in is an aerator discharging system because there's not room for replacement. And so I have to be able to also tell the EPA, so they'll approve a discharging system that the sanitary sewer is not feasible to tie into. So this city sewer line would have to be extended all the way to this property line, and then this homeowner can tie in here. Does that make sense?
It has to be,
So the city requires them to extend it to the far,
the homeowners
far
to
side.
extend it?
yes. Because the city's not doing a sewer extension, at least not at this point in time. All right. This is the homeowner.
Okay.
Yeah, on that, the extension, like I said, $150,000. And I've already got French drains that I put in my property out in the front to begin with, about a year or two ago, just because of the runoff from the roads and stuff like that. So that part's already out there to where they could tie in the discharge of the aerator system and stuff, so. But financially, there's no way I can afford to pay the city to run a line across. And here they told me that, because I was told that you could apply for funding. Well, they haven't even approved funding for this year yet. And so, and even if I did, there's so many other people on the wait list that who knows if it would ever get to me. So that's the big thing is, I mean, we're doing everything we can to conserve water. I mean, we're taking showers every other day. We're not flushing the toilet when we urinate and stuff like that until later in the day. So, and I've had to have my septic tank pumped out a couple times already, just to be safe. So. Thank you.
You're welcome.
So,
This is a typical quote
I was
for
gonna say,
that
because we have
distance
more
requirement.
quotes.
I mean, certainly the distance makes the price,
Right.
but as far as a price per foot for an extension.
I don't know. All I can tell you is that a few years ago, through our grant program, we did extend one, ballpark the same amount of feet. And the quote that we got was $60,000. That was probably, I would say, 2 to 3 years ago. I don't know price wise if that's,
So this one is, in my estimation, ridiculously high, but I also don't have anything else to compare it to. So if we had a couple of additional quotes, that would kind of let us know what we're really talking.
I called a couple other people and nobody came out to do it. Because they knew that most likely they're not gonna get the job. So they're not even really interested in coming out and spending their time to, the health department gave me a couple of names, and actually the guy from the city, Brian,
Brian works for the city utility department.
Okay.
and he even gave me some names that I called and only had one show up.
Is there any risk of not using that resource and tapping into the city and just putting an aerating system?
So, I mean, obviously we know that, aerators don't always
Right.
work or aren't always maintained. So we would have that. If the aerator's not maintained or not working properly, it would discharge untreated or only partially treated sewage. The other thing that we run into is if, 2, 3, 5 years down the road, the city decides they're gonna extend that sewer line. The city at that point could say, everyone's tying in, you don't have a choice, and then he would,
After trying.
incur that cost at that point. So,
And I had no issue.
But he would incur all that cost at that point?
well,
that
it depends
cost
on
of
how
care.
the city,
Unlikely. I mean,
Yeah.
sometimes they have programs where they just do the tap-in fees
Yeah.
only, or just the lateral out to the,
yes. Yeah.
it just depends on the project and what funding the city gets or has for it.
So, I don't know, probably could be ignorance on my part. Why can't you just pump out the septic tank and replace that septic tank? I guess
Because,
it's not that
yeah.
simple.
because that requires a installation permit from us, and the code specifically says that we're not allowed to permit any kind of septic system. So that would be issuing a permit to do a septic system on that property, and the code does not allow it to
Because
just.
it's close to the tank.
Yes, because there's
It's close
sanitary
by.
sewer there. And we know that sanitary sewer is the best means of treating your sewage.
So if
It's
there
not-
wasn't that code, theoretically, you would be able to approve it.
Yes,
So how do we change the code?
that's a state.
Yeah,
State law.
okay.
Yeah.
Ziba, you can correct me if I'm wrong, it's not the tank that's failing, it's the leach
It's the
field.
leach field.
So it's
that's
not,
failing.
that. So
Yeah, it's not the
it's not a replacement of the tank. The tank appears to be fine, I
It's
always say.
fine,
yeah.
It's the leach field. And
Okay.
after it moves past primary treatment in the tank, it gets a secondary treatment in the yard.
And
That's
most
the
of the
part
time,
that's failed.
most of the time, that's what is
Yeah.
failing.
Oh, yeah.
And there's no way to rectify that part?
No.
So are the two options, it sounds like, is they pay to extend the line or we do a variance and they install an aerator?
Yes.
And to your point that if that, whatever replacement system is installed, if that fails, there's no more room to put any other replacement, at which point you'll have to tap in, but we can at least give an aerator a chance. Because $153,000 is ridiculous.
Right.
As a cost to a homeowner to tap into something that is just that far away from a home.
Didn't you say it also has to be approved by someone else?
Yes, so what will happen is when we do discharging systems, aerators, the Ohio EPA, they have to apply for a discharging permit through the Ohio EPA. and they're the ones that approve the discharging, because those discharges eventually go to state's waters of the state, and they're trying to protect those. So they're the ones who approve the discharging systems and where they're at and where they're going. So one of the questions they ask on that application is sanitary sewer accessible? And on those, they want to know if it's within 400 feet. So makes it even farther away before they will approve them. But by you guys saying it's not feasible, the cost is too great, then the EPA takes that and says, okay, it's not accessible for them to tie into the sewer.
Any additional questions? Okay, so we have, before you, item 6B. Resolution, to approve a household sewage treatment system rule variance for 2862 Ashler Drive. Based on a previous conversation, you all know that. Okay. Did I read all this? Okay. Any additional questions?
So moved.
Second.
Okay, thank you, Lizelle. And can we have a vote?
Dr. Moore,
Yes.
Dr. Gullidge,
Yes.
Dr. DeGuzman,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt.
Yes.
Okay.
So I will offer to you an exit. If you want, you are welcome to stay, but you are also, yep. Nobody.
works since 6 o'clock this morning.
Thank you, I appreciate you.
Thank you.
Okay, item 6C, building maintenance. Mr. Cook.
What you have in your packet is a contract to continue to receive building maintenance services from the Clark County Board of DD. It's been an ongoing thing for a number of years, predated me. They give us excellent service. Really would like to continue with them. Slight price bump, not unexpected. But if you have any questions about the contract itself, let me know. Otherwise, I would ask for your approval on that.
This is item 6C. A resolution authorizing the health commissioner to negotiate and execute a renewal contract that will go through March the 31st of 2027. Nice. Okay,
So moved.
Second.
any discussion?
What, is there, how much is it?
It's an hourly rate. If you look on page, I think it's the annex, or yeah, it's the annex A. Let's see, I think that's where it says there. No, maybe it's not in the annex. Yeah, it's cost of services. It's $38 per hour for regular time, and after hours, weekends, it goes to $76 per hour.
Any additional discussion? Questions? Mrs. Hackett, though.
Dr. DeGuzman,
Yes.
Dr. Moore,
Yes.
Dr. Gullidge,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt.
Yes.
Okay, we have item 6D, FCFC shared funding agreement.
FCFC is Family and Children First Council, in case you didn't know. The law says that the health department and every county is a mandated member of this. Every county has an FCFC. And part of that is pooled funding or shared funding. So we have a responsibility to, in essence, pay for membership, which goes into their entire budget. I included everything in this. You can see all the members from all the different agencies that are mandated to be part of it, how much they each pay. We pay $8,000 towards this. The total funding from the pooled members is just over $66,000. This is something that I mean, we're mandated to be part of and have to pay it, and we pay it from the general fund.
So we have a motion to approve item 60.
So moved. Second.
All right, and is there any
Whatever.
questions? Okay, this is hackathon.
Ms. DeWitt,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Dr. Gullidge,
Yes.
Dr. Moore.
Yes. Item 6E, employee health insurance renewal. Mr. Pope.
This is a tough time of the year because a lot happens in a lot of different areas. And one of those areas for us, administration, is negotiating or finding a new health insurance provider for our medical insurance. So things are happening very quickly. And so what I'm asking for you is approval to negotiate with our current provider, which is Anthem. I don't have actual numbers to give you, but we've got some assurances that we're going to be able to renew at a cheaper rate than going out and finding a different provider. Several of you are nodding your heads that have experience with providers and third-party payers. I am very confident that we're going to, number one, get an increase. Doesn't matter. Number two, though, I'm confident that they're going to make it worth our while to sign an agreement that says we won't shop. And so that negotiation is going to be going on throughout the rest, probably this week and next week. I'll have something for you in May, but I do want your authorization because if it'll happen quick and they say, you got to sign now to get you this rate, I want to be able to do that. So if you be so kind, I would love to be able to negotiate that with them.
Okay. We have resolution 6E, authorizing the health commissioner to negotiate and execute a renewal contract for employee health with Anthem.
So moved.
Second.
Any questions? This is hackathon.
Ms. DeWitt,
Yes.
Dr. DeGuzman,
Yes.
Dr. Moore,
Yes.
Dr. Gullidge,
Yes.
Dr. Robinette.
Yes.
Okay, moving to 6F, grant submissions, Gracie.
Yes, thank you. So these are all kind of clumped together, but there are 5 grants that I'll be briefly talking about, but I believe it's just one resolution. So 4 of the 5 of them are all out of the Ohio Department of Health. So just starting with those, Creating Healthy Communities is our healthy eating, active living, access to healthy food, community gardens, community outreach and education on that type of thing. That's that program. It's for $95,000. This is a continuation application within the grant cycle. I'll skip over Safe Communities for just a second. The next ODH grant is the adolescent health. So this is adolescent health resiliency. So this is really trauma-informed care, equipping adults in our community to better serve our youth in those needs when youth need a trusted adult to turn to talk about whatever is going on in their life. So that is for $132,000, I believe. And that is again in a continuation of a grant cycle. The Lead Safe Home grant is through ODH. It is really a contract more so than a grant. We've had it for the last 4 years. So this funds our programming in lead poison prevention, awareness about getting childhood lead tested, and then also partnering with partners such as Neighborhood Housing Partnership to do some abatement work and things like that. That is based on the budget that we need. So I'm not sure exactly how much we're going to ask for at this time, but the grant application is due next Friday. So we'll be working on that. And then the last ODH grant is our Regional Prevention and Linkage to Care grant, which is our drug overdose prevention. So if you remember, that's for $350,000, a continuation year, and we are the region lead for our 17 county region to do awareness prevention work within the drug overdose arena. And then the last grant is our Safe Communities grant application. So that's through the Ohio Department of Public Safety. And that is our program that talks to both teens and adults about distracted driving, impaired driving, seatbelt. So if the click it or ticket, the drive sober, get pulled over, all of that programming comes out of the Safe Communities grant. Happy to answer any questions. You have the information in front of you, but
I have a motion to approve the grants.
so moved.
Second.
I do have a question. In the past, how much have we had for the, lead grant?
Yeah, so this past 2 year cycle, each year was 237,000.
All right, any other questions? This is Hackathon.
Dr. Gullidge,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. Okay, staffing. This is Hackathon.
Thank you. You can see here that we have an exciting new hire. So exciting, I put it on there twice. And sadly, then we do have some resignations, so I'll start with Chris.
Sure, I'll mention a couple. Jeff Horner, who is actually here tonight. Wave, Jeff. Jeff is our new Director of Finance. He'll be joining us on June 2nd, but until then, Jeff has so graciously agreed while he is still having his full-time job as an educator at the Northwestern schools to come in on Thursdays, and we're starting to seed his brain a little bit with all things public health. He's got the finance and accounting piece, is just customizing it to public health. So Jeff, we're glad to have you. I appreciate your time that you're giving us before June 2nd. Juggling that in school, and you brought your wife with you too. So excited to have Jeff join us. On the other side, the frowning face side of things for me is the loss of Christina Conover as our Director of Nursing at the end of May. To say that there's a lot going out the door with Christina doesn't nearly do it justice. As a person, just personally and professionally, it's going to impact this health department, the community, and public health as a whole. Saying thank you for the 3 years I've been able to spend working alongside you also doesn't feel like enough, but I appreciate you, everything that you bring to the table as a leader, not just a manager, but a leader outside these four walls in the community, what you have meant to people and other organizations. I wish there was like a delete button on this part of it. Unfortunately, there's not. So,
We
thank
can't
you.
disapprove that.
I can try. I can try. It's got good reasons, but, so I just wanted to share those two, and I don't know who's next.
Probably Lori.
Yeah, I have a couple, Paris Jones and Joseph G. Ray. So unfortunately, they'll be leaving us also.
And then Amy Hodick has been serving as our communicable disease supervisor most recently. She came to us as a disease investigator, and she has the opportunity to move to allow her spouse to do a residency in Madison, Wisconsin. So we're really excited about this new stage for them, but it does mean that we will lose Amy, who's been a great asset for CCCHD in Clark County.
I'm done, I'm sorry.
Wow, I'm still in shock.
Okay,
I
okay.
will miss you tremendously, Christina, my goodness.
Yes.
It's been a really great experience. I'll be here next month yet, but really great. I mean, just a ton of opportunities, you know, and a ton of growth. So thank you for all of that. Yeah, thank you.
Financial reports.
We need a motion.
Oh, I'm sorry.
I need a motion.
You are really thrown off.
All right, so let's see here. I need a motion and a second for the staffing changes.
So moved.
Second.
Okay, any additional questions? This hackathon.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Dr. Gullidge.
Yes.
Okay, financial reports.
Me.
Okay.
Linda's not here. I thought about just saying, Jeff, just sit up here. I'm just gonna hand you this. Can you just talk about it? No, I didn't want to do that to him. I wanted to come back. You've got the expenses and vouchers, the bills that we're paying this past month. As you look through those, if you have questions about any of them, I'll do my best. But otherwise, we'll look for a motion to approve us paying the bills this last month.
So we have 7A before you, a resolution to approve paying the bills from March 1st to the end of the month.
So moved. Second.
Any questions? Ms. Hathaway?
Ms. DeWitt,
Yes.
Dr. Gulich,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman.
Yes.
Okay. 7B, transfer and advances.
None.
Oh, good. Moving on. Okay. Item C, supplemental appropriations fund.
If you look in your packet, you will see a sheet that looks kind of like this. Landscape, it just says leave accrual fund 8239 at the top. When we started this year, we had about $22,000 in this fund. I didn't intend on using any of this. Most of this money is from the WIC grant over the years that we've been able to put money in there. But we did have one resignation from WIC that we could actually pay out of this fund. And so we didn't set a budget up. So to be able to pay out of the fund, we have to set up a budget. So what I'm asking you to do is set up a very small budget. You can see what that amended budget is listed as. It's just three categories: salaries, PERS, Public Employees Retirement System, and Medicare, which will allow us to pay out the leave on the accrued but unused leave of the person that left. So it's a total big whopping budget of $4,600 that the cash is there. We just have to say we're going to budget for it.
Okay, so that is item 7C, a resolution approving the supplemental appropriations fund. That need a motion.
So moved.
Second.
And is there any additional questions? This is Hathaway.
Ms. DeWitt,
Yes.
Dr. Gulich,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman.
Yes.
Okay. Monthly fund report?
You don't have to take any action, but what I'm looking at is, I have a bigger version than you on your iPad. There's a lot in here, but this was an attempt this year to give you a little bit more insight month to month of what income expense and the performance of each fund and the balances. I'll just go to the bottom. So if you look, what we're trying to do is give you some historical perspective here. So you see the 2024 in gray, annual budget last year, what it is this year in the green and the red. And you can see where we're at as a percentage of the original budget. You can see that we are down in both income and expenses. That was by design this year. And so neither of those are out of whack. You can see that our percent of our original budget for income, we're at 30% for the first 3 months, which is fine. And as expenses go, we're at about 21% of our original budget 3 months into this year. Also, I'll draw your attention to the very bottommost blue corner in the far bottom right, where our cash balance is just over $4 million, which is a healthy balance for our cash flow. If there's any questions, I'd be happy to answer those. I'm planning on taking a little deeper dive with you when we get through the halfway point of the year. But you've got this every single month, so you can kind of track where we're at and throw up any flags if you see them, but we'll take a little deeper dive in the first part of July.
Okay. Public health team reports. Ms. Zibby, thank you.
So last month, I told you that the Ohio Department of Health conducted our sewage survey and that it would likely be a few months before we received our final report. However, we received it about, 2 weeks ago. So a lot faster than I ever expected, but I'm happy to report that we do meet the minimum acceptable standards and have been placed on the approved list for sewage treatment system program. That being said, we do have some action plans that we need to write for a couple of items. We were expecting that. We knew there were some things that we needed to work on and do better on. So I'm currently in the process of writing that action plan to submit to ODH for their approval, but then we'll also be working on making some changes and adjustments to our sewage program. And then lastly, over the last couple of years, Ohio Department of Health has been working on switching our inspection report system from a program called HealthSpace to Acela. I think we're finally drawing near with a go live date of May 5th for our health department. And this week has been full of half days of training to show us how the new system works. We've been checking data over the last month to see what they brought in from HealthSpace into Acela and make sure that everything's coming over correctly. We've had a few bumps along the road, but hopefully we'll have it all ironed out and we'll be ready to go the beginning of May. That's all I have. Do you have any questions?
Very nice. Any questions? Okay, moving to nursing and clinics.
Okay,
Ms.
thank
Conover.
you. First, I want to start with introducing one of my colleagues. This is Nick, if you don't mind introducing yourself.
Hi, I'm Nick. I was the former clinic coordinator for the Refugee Health Clinic, and now I am disease investigator for the communicable disease team.
Welcome,
Pleasure to be here.
okay, to your new role.
Thank you.
Okay,
This is Nick Aldridge. He's been great to have, definitely helped us clean up some processes in the clinic, and we look forward to continuing to work with him. So, as far as the nursing report, a couple of things just want to highlight. I think I had mentioned last month that Connie Mitchell, which some of you know as our one of our PRN nurses and a Mercy volunteer, she has been working with 2 schools, and there on the front page of the report, you see that we did get to pass out glasses with the IC program, which is a part of the Ohio Optometric Association. And so that was a really fun success to see that kind of wrap up. And so 24 students in all got 2 pairs of glasses each. So that was great to be part of that. On the second page, a little shout out to Brittany, Bruce, and really all of her sexual health and wellness team. There is a certain number of encounters that they need to meet every grant year, and the grant ends March 31st, and she's been monitoring those, but we do have a lot of appointments that take a little bit longer, or, you know, just kind of always struggling, as do all the clinics with no-shows and things like that. So she and they really pushed here at the end to make sure they got their encounters, and in fact, they did meet their numbers, so very much thanks to that team for their continued dedication. As far as there's, you know, everybody's doing such great work, but I know we only have limited time. So on page 4 of this report, Madison and Carly are 2 of the people that work in the disease investigation, along with Nick now. And so they had an opportunity to go, and they were in an assembly for 96 graders, which I would have found very intimidating. But they did a great job of representing public health and what it would mean to be part of the disease investigation. So that was pretty exciting. They got great kudos, and the teachers were gonna tell other of their teachers' friends about it. So, and then we were really glad to be part of the LINKS project, the Black Family Wellness, which you mentioned last. So there's a couple pictures in from them, just from a couple of the teams that we had there. That was such a great event. We always get to meet a lot of people and do a lot of valuable screenings. And then Sandy and Randall both had an opportunity to join colleagues to learn about advocating specifically for some of the issues that affect children. So on page 5, there's a couple of pictures from their experience at the State House, specifically the safe gun ownership, or just safe and sight boxes for safe gun ownership, just concern about decreased assistance for housing repairs when it involves lead abatement, and just Medicaid for children and immunizations for children. So those were some of the topics. And I think that is all on that page. On the back, I just want to mention I had skipped diabetes prevention and management a couple times, but it kind of gives you a little graph or little chart of some of the activities that have been going on. So that's that. Now the disease investigator, or excuse me, the communicable disease report, a couple of highlights from that. You can see that sexually transmitted infections have, if we compare first quarter to last quarter, have dropped. So it would be great to hope that that's an indication of the rest of the year. So we'll keep looking at that. Influenza hospitalizations, that I'm sure that's not a surprise to anybody, with just anecdotally what we've been hearing going around, you know, comparatively high. And I don't believe if there was anything else that really stuck out to me, except for you mentioned the other day, you've been getting a lot of ticks. A lot of people are bringing in ticks already. And I did have one reported in March, so we'll see where that goes for the season. And let me see, I think that's it on the list. Thank you.
Thank you very much. Any questions? Okay. Early childhood?
Yes,
Ms.
thank
Lambert.
you. A couple of times a year, for quality assurance purposes, we do family surveys for all the Help Me Grow families. So at the beginning of the year, we do like a written survey, and then towards the end of the year, we do like random calling of the families. But I just got done doing the computations on the family surveys, and we performed well. Some of the questions, there's like 16 questions, but I just grabbed one just to give you an idea. You know, we want to make sure that the materials that the families receive, you know, how they feel about them, if the home visitor is understanding them, if they're helping them set goals, if they feel like they bring value to the home. We want to know all that. We kind of want to know like how long your home visitor is usually there to kind of get a gauge of how long the average visits is. And then there's a section on here so family can call me directly if they have any concerns about the program. So I think that's great. And then there's we have it in Spanish, and that one translated well, but the one that we did in Haitian Creole didn't translate as well. Some of the questions didn't hit right, so we've fixed those for the next time around. So I think though my favorite question on here is where they get to make a comment about the person that comes to visit them every week. And there was I then get to share those with the home visitors, and I think sometimes their job is pretty hard, but when they hear those, it kind of reminds them why they chose to do the work that they do. So, and I thought interestingly this year, the Haitian Creole families, wow, they were off the charts, complimentary and appreciative of the services that they receive. So just thought it was exceptional how grateful they are. So, that's all I have.
Any questions? Okay, women and infant, Ms. Schaefer.
Thank you. I have a few things to point out on the activity report. The breastfeeding rate for the visits in the hospital increased from 59% to 74%. And that's from the collaboration between the hospital breastfeeding staff, Melissa Klein, and our contract dietitian, Ashley Wagner. Next, I wanted to share a few pictures from National Nutrition Month. Thanks goes to our nutrition and breastfeeding supervisor, Isabel, and the nutrition team for the creation of the bulletin board in the front lobby, as well as preparing the reusable goodie bags with the nutrition supplies to the participants during the month. And we just couldn't pass up snapping a couple more pictures of this WIC mom and her adorable kiddo who was dressed for National Nutrition Month with her fruit-inspired outfit. So we had to get pictures of that. That was all that I had. You may notice in the picture with the bag, I just highlighted the this year's nutrition items, but we did have leftovers from last month that were also in the bag. So I did want to point that out because I know I passed the bag around and there were more items. But that's all I have this month.
I love your board on how to repurpose the leftovers. Nice. Any questions? Okay. Health planning.
Yes,
Ms. Gracie.
you have the update in front of you, so if you have any questions, I'm happy to answer those. One thing I did just want to point out, so I did like an additional update that doesn't specifically fall under health planning, but I wanted to make a note of it, so I'll just do those real quick. First, last week, April 7th through April 13th was Public Health Week. If you didn't know, so we celebrated public health, all things public health last week. We had Workforce Development Day. The t-shirts were a thank you to our staff and board. But one of the biggest highlights of the week is kind of become a staple is our salad spectacular is what we like to call it. So the admin team, everyone, all employees of the agency could put in a custom salad order, and then the admin team did a little assembly line and made those and then delivered those to eat last Thursday. So it's always a big hit. As you can see, I pulled some pictures out. So that was very fun. And then just an announcement and a reminder to everybody that the Minority Health Fair is next Saturday, April 26th from 10 to 1 at Hayward Middle School. So we're excited to be helping to coordinate that again this year. That's all I know.
Your salads look great.
They were delicious.
Okay, any questions? All right. Legislative updates. Mr.
I will keep this to about 4 minutes because that's kind of all we have left before the hearing at 7 o'clock. To say it's been a tough few weeks in public health, not only here in Clark County, but across Ohio and the nation is very much an understatement. There's absolutely been some trauma, and I'm not going to pretend that's not what it is, because that's exactly what it is. Things don't make sense, really, all the way up, all the way down. Doesn't appear to be a cohesive strategy, really, to any decisions that are being made, especially around funding. I do believe that the public health system is under fire. It's being systematically dismantled. I think it's being reshaped by ideology and not science and data. But that being said, I don't want it to all be negative. I want it to be positive. I told that to the admin team this week that we need to change our perspective now, because it's easy to just be negative about it. The positive thing is we're resilient. We have a strong passion for what we do here in public health. And as we had hard conversations a couple weeks ago with staff that are no longer with us, I was really moved by the fact that out of the mouth of almost every single person after I got done delivering bad news was, what's going to happen to my program? What's going to happen to my clients that I serve? It was uncanny. Every single person, nearly every person said that. And that just, it made it even harder to do what we had to do. But it really meant a lot to me that people that we have here share that same passion that as everybody sitting in this room, including all of you. It's something that we are going to be stronger somehow on the other side of. I'm not sure what the other side is totally going to look like. But I can tell you, I'm proud to be here. I know the core team that's sitting in front of you they're proud to serve. They're proud to be here too. I do want to give a sincere thank you to the people that we lost over the last few weeks, and I hope that they find their way back to public health one day somehow. But just know there are a lot of people here that this is way more than a job. If it was just a job and about money, they wouldn't be here. There's a deep passion here. So thank you to the staff that we lost and to the staff that we have. A couple other very quick things. One of the things that we promised to share with all of you as we enter the first part of this year with our new 2025 budget was an update on where we are with leave liability. It's kind of always been a bit of a question mark. We had this little leave fund, which I told you had $22,000 in it. We knew entering the year we had more than that on the books. And thanks to Shannon in her Excel wizardry that she have come to accustomed to, we can tell you that our leave liability for people who are eligible to either leave or retire is about $300,000. And so we have to start accounting for this every year as we talk about carryover dollars. Again, it's not something that's going to hit all at once, but everybody plays Powerball at the same time. And we have to be, aware that this money is going to go out the door at some point in time. So we have to say, we've got to name these dollars in our carryover for this. So that's my update for that. And again, thank you to Shannon for sharing that. We're going to give that to you quarterly. Gracie mentioned workforce development. I just want to thank you again for allowing us to close, to be able to do that 2 times a year in spring and the fall, to be able to pour into our staff with trainings and education. It's very important. I know it takes us out of the public service arena just for a couple of days a year, but it's very valuable. We hear it time and time again. It's nice for the whole staff to be together that frankly is split across 3 buildings. And so I like having that opportunity a couple of times a year. Couple of quick legislative updates. Actually, I'm not going to go too deep into it other than we'll continue to watch the metamorphosis of the budget bill for the state for the next couple of years and what that's going to mean for public health. We know that there's a lot of moving parts and pieces, and the legislators are doing what they're doing inside of committees. So the dust hasn't really settled yet. I can't tell you the whole picture of public health funding, but We do have quite a few grants. You're hearing the grants that Gracie's talking about. We know what's happened with federal funding. We're just going to very continuously watch that, intentionally watch it and work through Association of Ohio Health Commissioners legislative support arms to make sure that our voices continue to be heard at the State House. And then finally, I think the last thing that I really have time for, I want to thank Dr. Gullidge and Wittenberg for an opportunity last night. Gracie and I were privileged enough to go listen to Rosemary Garland Thompson speak, and then we had dinner with her, which was fantastic. I really appreciate the invitation. It was a fascinating conversation to listen to her at Wittenberg and then afterwards. Rosemary is an internationally renowned bioethicist. I'm reading this because I want to get it right. She's a senior advisor at the Hastings Center, regularly works as a consultant in healthcare, ethics, and accessible design. Your former mentor, probably still your mentor in a lot of ways. She was fascinating to listen to. So I want to thank you and the partnership we have with Wittenberg that made that possible. And it was very enlightening, I think, for both of us. So appreciate it. That's all, unless you have questions.
Any questions? Okay, good. So let's move into executive session.
So moved. Second.
Do we have a vote, please? Ms. Hackethorn?
Dr. DeGuzman,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
Yes.
Dr. Gullidge.
Yes.
Okay.